We have about 47 participants today, which is amazing. And so I'm Wendy Gant, and I'm the Community Education Specialist here in Wake County. And typically I speak to people in the community face-to-face and do mental health first aid trainings and other presentations as needed. So what we're going to do today is our first speaker is going to be Dave Mullin. He's an Alliance employee, and he also manages the Wake Network of Care. And then we're going to have Daniel Sims and also Sonya Reid speak to you about some of the COVID efforts in Wake County and talk a little bit about our healthcare and clinics that we have around the county. And then our last presenter is going to be Renate Bender. She is on our housing team here in Wake County, and she's going to talk about housing resources. She's also going to talk about the Independent Living Initiative. So we'll get started, and I want to introduce Dave Mullin. My co-host is going to be muting everyone, so take it away, Dave. You're on mute. Okay.
Gotcha. Good afternoon, everybody. Like Wendy said, my name is Dave Mullin, and I work for Alliance Health as a community liaison when I am not doing the Wake Network of Care. I'm down at Oak City Cares with our second presenter, Daniel Sims. We work together with people experiencing homelessness there. We use the network of care to get people connected with different resources and services all over Wake County, both at Oak City Cares and throughout the county. Not sure exactly what the mix of the audience is today, but a little bit about the purpose of the network of care is that it is designed for everyone, whether it's designed to get people easily and quickly connected with accurate information about all the different services and resources in Wake County. If you're like me, I spent many years doing case management, working with people with homelessness issues and adults through Adult Protective Services. As you probably remember, we all were carrying those binders around, and in addition to giving us a good workout, they were very helpful. The challenge with them is that the binders would go out of date very quickly. So about 4 years ago, Alliance and Wake County government banded together and thought it important to have some sort of online tool that would stay up to date with all the different resources in Wake County. So long story short, what was born from that discussion and funding was the Wake Network of Care. And currently it has about 2,200 different listings across 30 different categories. Everything is designed to be free, low cost, or if it does involve any kind of insurance, they're all providers that accept Medicaid or people without insurance. So that gives you a very quick summary of what the site is. As I mentioned, it is a free public service. Over the years, we've gathered the different service providers on it by their different categories. And we continue to be in touch with them every 3 months to make sure the information is up to date. What else can I tell you about it? I continually keep the site updated, and actually during this stay-at-home period, it's been a very productive time to go through the listings, all 2,200 listings one by one, to make sure that they are accurate and verified and all the links are working. So without further ado, I have a very brief video to show you just as a means of giving you a sense of the site. Since we each have 10 minutes, we don't have a lot of time to go through the site in depth. So this hopefully will give you a flavor of what it is, and then we'll talk a little bit about a couple current new features on the site that you may or may not have seen yet. So Wendy, could you play that first video, please?
Be patient. I'm going to get it.
Hello. What's that?
I can do it. Hold on. I'm going to find it. Hold on. Do you have it pulled up, Dave?
I do.
Can you go ahead and share your screen?
Okay.
Thank you. It'll go a little smoother, hopefully. If you look on the bottom, yep, where it says green, yep.
Yep, trying.
We're going to do it.
Sorry, everyone. First going at this.
Yep, same here.
Okay. Okay, well, here we go.
Thank you.
Can you see that?
Yep.
Great.
Thank you.
Thank you. Wendy?
Yep.
Sorry.
Can you stop sharing? Do you want to stop sharing?
Yes, please. There we go.
There we go. You're back.
Thank you. Sorry for our Zoom lack of knowledge. But anyway, as you can see, the site is really about trying to get people connected to the different resources, especially around the social determinants of health. We have all the food pantries in Wake County, different housing resources, especially during COVID here. People have been really looking for rental assistance, foreclosure prevention, everything you can possibly imagine. So it's been a very trying time for everyone. The site is there to be a resource and a help to get people connected quickly and easily with the different types of services that they need. Wendy, can you just share that last slide, please?
Yes. Let me pull that
Just
up.
wanted to give you guys a couple ideas of what we have currently up on the site. Can you switch to the slideshow?
Can you see it?
If you hit slideshow up top,
Thank you.
over to the right, over the right. There you go. From beginning.
Can you see that?
There you go. Perfect.
Thank
Perfect.
you.
Okay. So back in the middle of March, Passage Home had created a tool that would help people stay up to date with the different COVID-19 community resources. As you can imagine, and you've observed over the past month or so here, everything is changing by the day. So they asked us to host this particular tool and expand it. If you click on, this is a screenshot from the homepage, but if you click on each of these little blue blocks, it'll have all the different updates, which has been really a daily thing, updating all the different resources for folks so they're in the loop as to what particular things are happening, what's new, what's shut down, what's starting again. We have a very comprehensive rent and eviction assistance section on there, a very comprehensive mental health section to really get people connected with those services, like I say, because they keep changing by the day. The bottom blue block is a little promo for a new feature that we've just added called live chat. On Mondays, Wednesdays, and Fridays from 9 to 12, a Wake Network of Care agent is on the site live and connecting people as they type in with the different types of services and resources that are around Wake County. Please feel free to jump on. It's for everyone, like the entire site. So if you have questions about any particular resources or you're looking for something that's very specific, jump on and ask a question. If it's not, if we're not on live or you're on during a different time period, then there is a help bubble where you can leave a message and we'll get back with you as quickly as we can to your message. Okay. So hopefully that's like a little bit of teaser. I'm out of time, my timer says. A little teaser, so please feel free to jump onto the site, www.wakenetworkofcare.org, and let us know what you think. It's a work in progress always, and we love to have feedback about how to make the site better and really meet the needs of everybody here in Wake County. Thanks so much for your time and your attention.
Thank you so much, Dave. Dave's also available to, if you want to reach out to him during your Zoom meetings or team meetings, he can join and show you how to navigate and give you a little bit deeper dive into the website. So that's great. Thank you so much.
Thank you.
All right. So we're going to move on to Daniel. If you want to talk with us, please, about some of the efforts that have been going on in Wake County around COVID, since this is such a different kind of time for all of us.
Yeah, absolutely. I'm going to speak actually to one specific part, and as far as the clinics and human services in general, I'm going to refer that to Sonya. She knows much more about that than I do. I haven't been in the health department in quite some time. So when all this came about, the county opened up its emergency operations center. So basically we were all, most of human services staff and county staff in general, we were redirected into doing other roles to help with COVID-19 efforts, specifically in the county. When this initially happened, I was put into our call center at first. And so what this was, when the proclamations came out, we had businesses calling about, non-essential, essential businesses. What does this mean? Resources, references, things like that. So we would help to redirect them, answer any questions they had. Also, individuals calling about signs and symptoms about COVID-19, where to get testing at. And this was back, obviously, when testing was very, very few and far between. It's gotten better, obviously, but back then it was hard to find resources for that. So we would help to kind of try to, resource them out to find testing resources, and then, just give them general information, as this was very new to them and to all of us in general. The county opened up 3 hotels. So Healthy Hotel 1, a Healthy Hotel 2, and then an isolation hotel. I'm currently a site manager at an isolation hotel, and this houses individuals who have tested positive for COVID-19, those who have been in direct contact with somebody or are being tested. And as Dave alluded to earlier, a lot of them, but not all, are the same population we generally work with in general, those experiencing homelessness, very high-risk individuals. And so it's to help alleviate the spread. Obviously, we don't want this to help obviously make this work, or to not make this worse than it already was. So at the Healthy Hotel, they house individuals who are high risk, so 65 and older, immunocompromised, I can never say that word, uncontrolled diabetes, things of that nature. So they house those individuals. They have to be referred by usually a social worker, caseworker, hospital, somebody like that, and they have to meet specific requirements or the guidelines that the CDC defines as high risk. And then our mass care unit essentially would refer them and, help with that process of getting them into a hotel. We were very, very busy at our isolation hotel initially. We had anywhere from 20 to 25 people staying there. Now we're up to only a handful of people. Of course, that could change at any moment. But what we do is we work with, a different individual, and then we help, house them. We keep them isolated for, the time that they need to be monitored by Wake County. We help them with any resources they need as well during that time frame, and help to get a plan together to when they are safe to go out about where they're going from there. It's been interesting because this is not what I normally do on a day-to-day basis, but we have to be all hands on deck and do whatever the county needs us to do to help with this problem countywide. And so I've been very happy to do so, and to lend a helping hand where needed. As I said, I want to leave Sonya as too far as the county response and what the clinics are doing, how they're operating, and how they're still seeing our patients now. But if anybody has any questions about the hotels, I can answer those whenever we accept questions. That's just a general briefing of what the EOC response is right now.
Thanks. Thank you. Sonya? Hi.
Hi, well, good afternoon, everyone. I am Sonya Reid, and I serve as the program manager for our health promotion chronic disease prevention section. And I also oversee our Wake County drug overdose initiative. And Dave, you are an integral part of that too. So thank you for your presentation to highlight resources in the community. What I'll do is I will share also what we've been doing. I can't say this is all of Wake County, but certainly with Wake County Human Services being one of the largest departments of Wake County government, we have found ourselves front and center in terms of dealing with this whole COVID-19 response. As you can imagine, we want to adhere and model the practices that CDC has shared with us from the very beginning about social distancing and all of the different preventative measures that are in place to keep our providers safe, but also to keep our community safe. So when we looked at our clinics, our deputy director, along with our division director, who is Chris Kippis, Chris is really being pulled between our Sunnybrook building and more so now with our emergency operations center downtown, because Wake County is looking at now its next phase, which is the massive testing phase. So Chris, as our division director, is working with other community stakeholders like hospitals and others to look at what that would look like for the mass testing that we would need to do to satisfy the formula for the state. In a call this morning that we had, it looks like for Wake County, we would need to test somewhere between 1,200 and 1,800 people per day. And so we're really trying to work very seamless with our other partners across the county so that we can do this as efficiently as possible. When we look at our clinics, so today I'm in my office. I'm usually in the office at least one day a week, sometimes more. Outside of that, I am assisting our deputy director on site. We have our own little mini EOC going on here at Sunnybrook and Swinburne. But when we look at our clinic operations, most of our clinics are scaled down. You may have seen something recently about immunizations, that administering immunizations across the board is down. And so in response to that, we have opened up our Clinic C, which is our child health clinic, on a limit for, with limited slots, obviously, for those children that are 2 and younger to be able to receive those vaccines that may have been put on pause initially when we first entered into the COVID response mode. So those immunizations are being scheduled now, wherein families can come in per appointments, and newborns can be rechecked in our clinics. So, you know, folks are still delivering those healthy babies, and so we want to keep them on track with their immunizations. Um, PPE, which is personal protective equipment, certainly has dictated much of how we are delivering our service. We once again want to make sure that our providers are protected as they attempt to provide a service to the community. So with that, our dental clinic has been suspended, and that has been because of PPE, as well as the proximity of the service area. If you've ever been in our dental clinic, it's kind of an open area where chairs would not have the spacing requirements normally that we are trying to adhere to now with social distancing. And so our dental services have been suspended, but our dental director is working with other providers in the county to be able to respond to emergency type dental requests. For those pregnant women, our prenatal services are still happening. A lot of what we're doing right now with our clinics is happening through telehealth. So it's been a great way to interact still with individuals that might not even want to come in the building. Even if we offer the service, they want to be able to be serviced remotely. So for those that can be serviced remotely, certainly telehealth has been a positive for us. We're doing telehealth with some of our most vulnerable groups, like our HIV positive individuals will initially have a telehealth interaction, and then based on the triage and an assessment, we might then prescribe some type of expedited patient or partner therapy for them. And then those that come into the office will come in on an as needed basis. Our family planning clinic is operating right now, providing depot Monday through Friday, and our prenatal patients are also being seen in our what would have traditionally be our women's health clinic. So our space, we're trying to keep our space as controlled as possible, so that we are able to maintain all of our cleaning and sanitation practices. Now, as a part of Wake County Human Services, we also have regional centers, and all of the services at the regional centers have been suspended. And what has happened with the staff that would provide clinical services is that those staff have been either deployed to our Sunnybrook site, or they may be helping at the EOC center through the call center or mass care, or they may actually be assisting at the hotels that Daniel referenced during his part of the presentation. So, as he said, it's all hands on deck. Everyone is working within scope of service and to their maximum capacity. Pharmacy is on site here at our Sunnybrook building, and coincidentally, just as COVID came about, we were also in the midst of a remodel. So Jason Wittes, who is our pharmacy director, has been having to juggle both of those things. We are hoping to resume with our full pharmacy services on June 2nd. But in the interim, what happens is that patients are not allowed to come into the building for pharmacy services. They will have their prescription refills done via a call-in line, and those services are now curbside. So Jason's staff is per appointment going outside of the north side of the building and delivering to those individuals, those that still need their scripts done. We're not dispensing any controlled substances, and we're not dispensing any OTC meds right now, just based on our new pharmacy guidelines during this period. But hopefully on June 2nd, we'll be able to resume with all of those. Any patients that we see that would require a prescription, those will be received, filled as they are received from the provider. And what the patient will do is walk to the front of the building on the north side of the building, which is adjacent to New Bern Avenue, and they'll be able to pick up those prescription refills that way. We are still providing some limited lab services on site. And so the lab is adjacent to our wellness clinic, which we refer to as Clinic E, where we also provide adult immunizations as well. So we do have 2 LabCorp staff, and we have typically 3 to 4 of our human services staff each day that are supporting lab services. And then another program here is our WIC program, which is our Women's, Infant, and Children's section. Almost all of those services are being provided via telehealth. There are curb services available to families that need specialized formula and for women who are needing breast pumps. So those are 2 of our curbside services. And if they have questions, there is information noted that they can call in and get those questions answered. Right now, since our schools are out, our school health team, our team of nurses have worked tirelessly with our initial strike teams with testing. They continue to do testing. They will also be a part of the contact tracing that is to follow when we really ramp up for mass testing across Wake County. They'll be an integral part of that, and we certainly appreciate all that our nurses are doing. So not sure how many nurses are on this Zoom call, but let me say personally, and also on behalf of Wake County Human Services, we really, really, really appreciate our nurses. And we appreciate you so much. You all turned it from a week to a month, so we can love on you all the month of May. So thank you once again to all of our nurses. Vital Records is still an operational service here. And so Vital Records is still open on Tuesdays and Thursdays. I'm having to look at my notes, so I'll make sure I say this right. Tuesdays and Thursdays from 8:30 to 4. Vital Records is located on the ground floor of our building here at Sunnybrook. And Monday, Wednesday, and Friday, they're working, but they're working remotely. So Environmental Health is also open, and that's a integrated service with our lab, and that's on ground floor, so any well water testing can still happen during this time as well. So as of this morning, when we had our check-in with each other, there's a daily check-in, as you can imagine. There's daily check-ins and throughout the day, but we show here in Wake County this morning 1,056 cases, positive cases, and some of those numbers represent individuals who are actually being housed at 2 of the hotels that Daniel referenced earlier. Once again, it is to protect them and to also protect our communities and to help us continue to slow the spread of this virus. So that's a lot, but I want to be sensitive to the time and to those that may follow me. And if there are questions, I'll watch the chats and see to make sure that we answer them. Oh, let me say this one. I think, Wendy, this is coming from you. Effective tomorrow, we are asking clients that enter our building to have on a facial covering. Until now, it was not a requirement because we, once again, back to PPE, we didn't want to require something when we didn't have at least some base of inventory to be able to support individuals who did not have a mask or some type of face covering. But effective tomorrow, we will be requiring all consumers to wear a mask when they enter for service. Our staff are already masked. And for those that are not working in a clinical setting but might actually be in the building, we are asking them as well that when they go into a common area that they will also have their mask on. So that will be effective tomorrow.
Great, thank you.
Mm-hmm.
That's great. Okay, thank you, Sonya.
You're welcome. Thank you.
Yes. Next, we're going to have Renate Bender with our housing department here at Alliance. And she's going to talk to you about the independent living initiative. And then we're hoping that folks have questions. So take it away. I like your background.
Thank you. Wendy, do you happen to have the slide that I shared with you? Do you mind sharing that?
Okay, why is there a back? Hold on, let me go to slideshow.
Thank you.
There we go.
Great, awesome. Thank you so much.
Now I have to figure out how to advance the slide.
I think you just click on the right or at the bottom. It should
do it the arrow. Okay, I'll figure it out. Thank you.
Okay.
All right.
So good afternoon, everyone. Again, my name is Renate Bender, and I am the housing coordinator for Wake County. I do represent the ILI program that Alliance offers. And so just to give you a little bit of background about myself, I initially worked as a provider, and I have navigated the ILI system from that end, and now I'm on the other end, so I have a unique perspective of what it takes to kind of successfully navigate and approach this system. Wendy, could you go to the next slide for me? I can't hear you, you're muted.
Be patient. I'm going to figure it out.
No problem. And so just in case, we can't pull it up, I can basically let you guys know, as you can see, ILI, which we typically call it, stands for the Independent Living Initiative. And so it's our housing assistance program. It's actually an eviction prevention program, as well as stated, a housing assistance program for individuals that are experiencing homelessness or at risk of experiencing homelessness. And so, all right, here we go. No, we don't. Okay.
Do you have it?
I do.
You may be able to share it easier than me.
All right, let's do this. Okay, can you guys see my screen? All right. Awesome. And so as you can see, ILI, it is a one-time, let me see here, move this out of the way. Okay, so it's a one-time short-term rental assistance program, and it's for individuals, again, that are experiencing homelessness or at risk of becoming homeless. Now, the individuals must have a behavioral health challenge, such as mental health, IDD, or substance use diagnosis, and they must be actively engaged with an Alliance contracted provider. And so in order to be eligible for the ILI program, again, they must be engaged with a provider that Alliance contracts with. They also must reside in either, one of our 4 catchment areas, which include Durham, Wake, Johnston, or Cumberland. Now, I simply cover Wake County, but I do have colleagues that cover both, Durham, Johnston, and Cumberland County. So depending on where the individual resides, that is what coordinator that you would speak with. Also, the individual must have an income that's, either at 60% or below the area median income, and they must have experienced a recent crisis. Now, ILI is not a voucher program. I want to reiterate that because sometimes individuals may mistake it as a voucher program. It's simply just a short-term financial assistance program that Alliance offers, because we all know housing is a social determinant. And so if an individual, it goes back to Maslow's hierarchy of needs. So if an individual does not have adequate housing, it makes it difficult for them to focus on, other things such as employment, even medication compliance or adherence. And so this program helps to cover the gaps of those individuals that may be experiencing a crisis. We typically find that individuals that utilize this program typically are coming out of either a detox program, a shelter, and things like that. And so what this program does is, of course, it provides that temporary financial assistance, but it decreases the utilization of emergency services. And so ILI, I typically tell individuals, ILI is a last resort option. We do encourage for the providers that are working with these individuals to look at every other option in the community that's being offered, because ILI is it's a small set of funds and it's very, very temporary. Now, an individual, they can either have Medicaid or be uninsured, and they must be able to sustain their housing once assistance ends. Now, during this time, during COVID, we do find that, we have become a little more lenient with some of the stipulations, such as an individual's ability to sustain their housing, meaning that I have seen, of course, an increase in applications. It's been very, very busy right now, or lately. And so sometimes individuals may have zero income, but there is a plan in place where they're working with their provider to eventually obtain their disability benefits, or they're working with their provider to eventually obtain employment. And so we have relaxed, the rules a little bit in consideration for COVID-19. I see the chat box lighting up here, so I'm assuming maybe there are some questions. So let me take a look here. Okay. And so it says, would an older client whose parents are getting too old to care for them be considered a crisis? If the parents have given the individual a date to leave the home, then yeah, that would be considered a crisis. Okay. And so again, the individual must be engaged with some type of contracted provider, and that provider will actually need to go through trainings that we offer. Now, we typically would offer the trainings once a month. You can find that on Alliance's website on our calendar. But recently, we've increased those trainings to weekly. I've had providers contact me, and I have given one-on-one trainings. So we've become very flexible with offering those trainings. And of course, the purpose of those trainings is to not only provide more in-depth information about the program, but to register that provider in our system so that they can access the ILI system to apply on behalf of their client. And so let's see if I'm missing anything here. Yes, so we've increased the trainings, it's eviction prevention. And so I think that pretty much covers everything. As you can see, here are the eligibility requirements and everything. And maybe I've forgotten something, but of course, if you guys have any questions about the program or access to that training to become registered, then I am available, and the floor is open. I think that's it.
Thank you so much. So, very quickly, I want to show you a flyer that I told oops. Can everyone see that or no? I did not share screen. Hold on, let me share my screen. All right. Alliance right now currently is managing the Hope for North Carolina grant. And basically this number is available for crisis counseling, and it's free and confidential for anyone who'd like to utilize it. And the number is 855-587-3463. All right, and we're going to let Brandon now facilitate our questions that are coming in.
Thank you, Wendy. Daniel, if you don't mind, do you mind sharing that information that you sent about the temperature checks with the nurses and staff, just for the folks who did not read it in the chat box?
Daniel, can you hear? Oh,
Can you hear me? Okay,
yeah.
good. Yeah, so every morning we get a call from our public health nurses to see how many residents we have to make sure it hasn't changed from the day before. And then they come and they check. So starting now, there's a site manager and there's an incident commander who's usually our disaster preparedness consultant or a fire staff. And then we also have allied security, and we have a Wake County Sheriff's deputy on site as well. And they come and they check our temperatures, make sure we're not experiencing any signs or symptoms related to COVID-19 or similar. And then they also go and do a one-on-one with every resident there to make sure that their temperature hasn't changed, whether good or bad, to see if they're experiencing any, any type of other signs or symptoms. And then they document that. They get in contact with mass care and so forth every day, just to see how that individual or individuals are doing, and so that they can help and see when they are ready to be released or no longer require monitoring. But this is an every morning thing, and they check that. And if there's ever any, they have a pretty detailed discussion with every individual that morning when they're there. For us, it's just simply taking our temperatures and making sure there's nothing new that we need to let them know about.
Excellent, thank you. And so one more question about that. How many folks are currently being housed at the ISO hotels?
We have 3 currently now. I don't know if that's changed as of today. I'm not there today, but as of yesterday, and that can change at any moment. So,
thank you, sir.
Yep.
So for Renata, for ILI, does the consumer have to be engaged in enhanced mental health services, or can they be out in outpatient therapy and still qualify?
In